A woman in her late 70s once said something to me that I have thought about ever since. She said, "Doctor, I've stopped mentioning things to you because you'll just tell me it's my age." She was not being rude. She was describing something I hear constantly. And she had a point because the phrase, "it's just your age," has become one of the most damaging sentences in medicine. It gets used two ways, and both cause harm. It frightens people about things that are completely ordinary, and it dismisses things that are genuinely treatable. So today I want to do something quite specific. I am going to give you 7 things that people over 70 worry about that are entirely normal and that you can stop losing sleep over. And then I am going to give you 5 things that get blamed on aging every single day in offices like mine that are not aging at all. Those 5 are treatable. Several of them are very treatable. And they are missed because everyone involved, including some doctors, decided they were just part of getting old. Let me start with the reassurance, because I suspect several of you need it. Normal number 1. You cannot find a word, and it is on the tip of your tongue. This is probably the single most common thing that frightens people about their memory. So let me tell you what researchers actually know about it. Word-finding pauses become more frequent with age. That much is true and universal. But here is the reassuring part. Studies show that older adults recover those words at nearly the same rate as younger adults. The word is not gone. Retrieval is slower. Think of it as a very large library with a slightly slower catalog. The book is still on the shelf. The distinction that matters is this. Normal is pausing, then finding it, either on your own or with a small cue, and carrying on with the conversation. Not normal is losing words so often that you stop mid-sentence and cannot recover the thought, or beginning to lose the meaning of common words rather than just the label. If you know exactly what you mean and simply cannot summon the word, that is the normal pattern. Normal number 2, everything takes a bit longer to think through. Processing speed declines with age. That is one of the most consistent findings in all of cognitive research. Multitasking gets harder, and following 2 conversations at once becomes genuinely difficult. But here is what does not decline. Vocabulary generally continues to grow throughout life. So does accumulated knowledge and, in most people, judgment. You are not losing the library. You are reading the catalog more slowly. The test that matters is whether it interferes with daily function. Taking longer to balance the checkbook is normal. Being unable to work out how to do it at all when you always could is not. Normal number 3. You wake up 2 or 3 times in the night, and you get sleepy earlier in the evening than you used to. Both are ordinary. Sleep architecture changes with age. You spend less time in the deepest stages, so you are more easily woken. Your internal clock also shifts earlier, which is why so many people over 70 are tired at 9 in the evening and wide awake at 5 in the morning. That is a phase shift, not insomnia. The question that matters is not how many times you woke. It is how you feel during the day. If you wake twice, fall back asleep, and function well, that is normal aging, and I would not medicate it. If you are exhausted all day, falling asleep in conversations, or lying awake for hours in distress, that is different and worth investigating. Normal number 4. You bruise on your forearms from things you do not remember. Purple patches on the backs of the hands and forearms, appearing after minor knocks, are extremely common after 70. There is a name for it, actinic purpura, and it is largely the result of decades of sun exposure thinning the supportive tissue around small blood vessels. The skin itself also thins, and the fat padding underneath diminishes. So the same bump that did nothing at 40 leaves a mark at 78. Now the distinction. Bruises on sun-exposed forearms and hands are usually this. Bruising in unusual places, such as the trunk or thighs, or bruising with bleeding gums, frequent nosebleeds, or blood in the urine or stool is a different matter and needs checking, particularly if you take a blood thinner. Normal number 5, you do not feel thirsty. The thirst signal genuinely weakens with age. That is a physiological change in how the brain registers fluid status, and it is why dehydration is so much more common in older adults. So if you notice You rarely feel thirsty. That is not a personal failing, and it is not unusual. It does mean you should drink on a schedule rather than waiting for the signal, unless your doctor has given you a fluid restriction for heart or kidney reasons. Normal number 6, you need much more light to read. By 70, the pupil is smaller and the lens is denser, so substantially less light reaches the retina than in a younger eye. Many older adults need several times more light for the same task. If you find yourself dragging the lamp closer, that is optics, not failure. Better lighting solves a surprising number of complaints, including some falls at night. Floaters, those small drifting specks, are also usually ordinary, but I will come back to the exception, because it matters. Normal number 7. You feel the cold more. Body composition shifts with age. Less muscle, less subcutaneous fat, thinner skin, and reduced circulation to the extremities all mean you lose heat faster and generate less. Feeling cold when others are comfortable is common. Persistent, dramatic cold, intolerance with fatigue, weight gain, constipation, and dry skin is a different picture, and that is a thyroid test. If this is useful so far, tell me in the comments which of the 7 you had been quietly worrying about. I read everyone. Now the other half of this video, and I want you to pay closer attention here because these 5 are the ones that cost people their independence while everyone nods and says it is just age. Not normal number 1, falling, or feeling unsteady. I want to be as clear as I can be. Falling is common in older adults. Common is not the same as normal. Every fall has a cause, and in most cases the cause is a combination of several correctable things. Medications that lower blood pressure or cause drowsiness. Blood pressure that drops when you stand. Leg weakness. Inner ear problems, including that crystal condition I have discussed before, which can often be cured in one appointment. Vision, including new progressive lenses, foot problems and unsuitable footwear. Here is what concerns me most. Most falls are never reported. People get up, feel embarrassed, and tell nobody, including their doctor. And a fall is the single strongest predictor of the next fall. So if you have fallen in the past year, even once, even if you were fine, please mention it. There are structured falls assessments, and they genuinely reduce future falls. That is not aging. That is a list of fixable problems. Not normal number 2. Losing weight without trying. I want to be emphatic about this one. Unintentional weight loss in an older adult is never simply aging, and it should always be investigated. The causes range from the very treatable to the serious. Thyroid problems, depression, dental pain, or poorly fitting dentures making eating difficult, swallowing difficulty, medication side effects, malabsorption, and yes, sometimes cancer. The reason it gets dismissed is that appetite does modestly decline with age, so a smaller appetite is written off. But losing pounds you did not intend to lose is a signal, not a fact of life. If clothes are looser and you did not plan it, that is an appointment. Not normal number 3. New confusion. And this one I would like every family member watching to hear. If an older adult becomes confused over hours or a few days, that is not dementia arriving suddenly. Dementia does not work that way. Dementia develops over months and years. Confusion that appears over hours or days is called delirium, and it is a medical emergency in the sense that it almost always has an acute cause. The common causes are infection, particularly urinary or chest infection, dehydration, medication effects, uncontrolled pain, constipation, and low sodium. And here is the detail that matters enormously. Older adults frequently do not mount a fever with a serious infection. Sometimes the only sign is that they are suddenly not themselves, confused, drowsy, agitated, or seeing things. So if your mother is suddenly confused this week and was fine last week, that is not her dementia progressing. That is something happening right now that needs to be found today. Not normal number 4, feeling low or having lost interest in things you used to enjoy. Depression is not a normal part of aging. I want to say that as plainly as I can because it is one of the most persistent and harmful myths there is. Late life depression is common, and it is treatable, and it is chronically underdiagnosed for two reasons. First, older adults often do not describe sadness. They describe fatigue, poor sleep, aches, poor appetite, or memory problems, which means it gets investigated as a physical problem or dismissed as aging. Second, and this is the part that troubles me most, when someone has genuine losses in their life, a spouse who died, friends who have gone, a body that does not do what it used to, everyone around them concludes that of course they feel this way. Grief is normal, sadness after loss is normal and healthy, but losing all interest for months in everything you once cared about is not grief, and it is not aging. It is a condition, and it responds to treatment. There is a specific thing worth knowing here too. Depression in older adults can cause genuine memory and concentration problems severe enough to look like early dementia. Clinicians sometimes call it pseudo-dementia, and it can improve substantially when the depression is treated, which means some people are carrying a dementia label they do not have. Not normal number 5. Leaking urine. This one is enormously common, particularly in women, and almost nobody raises it. People buy pads, stop going out for long, avoid travel, sit near the door, and quietly shrink their lives around it. And they never mention it because they assume it is inevitable at their age. It is not. There are several different types with different causes and different treatments. Pelvic floor training has real evidence behind it and is often first line. There are medications, though I would note that some older bladder medications carry anticholinergic effects and are worth discussing carefully given what is known about long-term use. There are procedures. And there are entirely reversible causes that get missed, including urinary infection, constipation pressing on the bladder, diuretic timing, and in men, prostate enlargement. Something as simple as adjusting when a water tablet is taken can transform someone's day. Please raise it. I promise you that whoever you tell has heard it many times before. Now, 3 honest statements. Normal and not normal are not always cleanly separable, and there is a genuine gray zone in between. Individual circumstances matter enormously, and a change that is fine in one person is significant in another. And this video is education, not medical advice. I am a physician, but I am not your physician. And before I close, the genuine emergencies, which are never aging. Sudden weakness or numbness on one side, facial droop, or slurred speech, sudden severe headache unlike any before, chest pressure or heaviness, particularly with exertion, and remember that in older adults and in women, this often presents as breathlessness, nausea, or overwhelming fatigue rather than classic chest pain. Sudden vision loss, or a curtain across the vision, or a sudden shower of new floaters with flashing lights, which can mean a retinal detachment and where hours matter, coughing up blood, or blood in the stool or urine, and new severe abdominal pain. Let me finish where I began. That woman told me she had stopped mentioning things because she expected to be told it was her age. I think about that whenever a patient starts a sentence with, "This is probably nothing but." So here is what I would ask of you. If you are worrying about a word you could not find, or bruises on your forearms, or waking at 4 in the morning, I hope this video has given you some peace, because those are ordinary. But if you have fallen or lost weight you did not mean to lose, or stopped enjoying things, or you are managing your bladder in silence, please do not file those under aging. Those are the ones worth the appointment. And if someone you love became confused this week, do not wait to see if it settles. Tell me in the comments which of the 5 nobody had ever told you was treatable. I would guess it is the last one because in my experience, almost nobody brings it up unless they are asked directly. Take care of yourselves, and I will see you in the next one.